Hello? Hello? Hello, guys! I can't see the chat! I cannot see the chat. What the heck? Wait, where's the chat? YouTube chat. Ito. Where are you guys? I can't see you. I think I need to... there we go. What if I do this? Alright. Hello, guys. I can't see the chat. What is up with this? Oh no, the chat doesn't exist. Anyway, good evening, everybody. Good evening. I can't see the chat. The chat box is empty, and even on my OBS, the chat's gone. Wait, how do I get the chat back here, bruh? Where is the where is the YouTube chat? The YouTube chat is gone. I don't know. Yeah, I can't find the YouTube chat. What the freak? La. Shintoki, thank you for the sub. Okay, since I can't see the YouTube chat, I have to go to YouTube itself. Yeah. Even on my stream, the chat is not working properly. I don't know why. Bakit kaya? And yet Ba't ganun? Why is the chat not working? Why? Wait. Ito ba? Oh wait, no, this is Twitch chat. Nope. I'm opening Twitch chat. Wait lang. Ito. Ano yun? Aha! There we go! I found the YouTube chat! I found you! But you guys are not popping up on my wall. Unfortunately, you guys are not showing up here on my stream for some weird-ass reason. Okay, there we go. Alright! Try to start. I don't want to start because then that would mean I have to end the stream. Right? Different scene. No, I'm in the right scene. Anyway, I'll just jump right into the... Let's see, even here. I mean, even here you guys are not out. What happened to you guys? Where are you? Where's the chat? Where is chat? Okay. Unfortunately, chat does not exist. Good evening, everybody. So, if you notice, we have a poll. We have a poll which I left up actually ever since I put up this stream. Yeah. Okay. Chat's invisible. Yeah, unfortunately, I don't know what's wrong with the chat. I can't see you guys. For some weird-ass reason. The chat is not seen. I don't know why. Unless, teka. Oo nga, wala yung chat talaga. I'm trying to fix it, but no. It's not working. We're gonna have to proceed through this without the chat. Anyway, this is uploaded on... This is a YouTube stream, so... You can always watch the live chat. If you want to get back to the VOD. Yeah? Alright. So, again, good evening, everybody. Welcome to our medical education stream for the month of November. Yeah? Tonight, we're gonna talk about... This is an NNN special. We're going to talk about No Nut November. Specifically, your nuts this November. Yeah. We're gonna be talking about your nuts this November. Okay, guys? Oh wait, I forgot to set up my, hold on. I forgot to set up my tablet. Let me set up my tablet, hold on. There we go. Alright. F3 on F bread, F Kamiya. Yeah, F Ryu. They're the only The only dudes I have here, I mean the only full-bodied dudes I got, I'm just borrowing their PNGs. I'm just gonna borrow their PNGs for this presentation, okay? Oh yeah, by the way, like I said, there was a poll since this afternoon, or since this morning. So apparently the winning option here is non-stop nut. Okay, you guys are all, I'm gonna end the poll now. How do we end the poll? I'm gonna end the poll now. We're done. You guys are done answering. Yeah? Okay. So a lot of you, are non-stop nutting. You degenerates. What is wrong with all of you? How could you non-stop nut? Don't you like drain the energy and the fluids out of your body? How do you do that? You degenerates. You're all degenerates. The heck? It's funny that in Ian, nuts refers to the male family jewels, but if you translate nut to Tagalog, it refers to the female family. Really? Oh yeah, like yung mga peanut, ganun. Okay. Bakit ikaw din naman na, hey, I don't non-stop nut. What's wrong with you? I eat nuts, but I don't nut. You know? But I don't eat nuts non-stop. What the heck? That's unhealthy. Alright. Male reproductive system. Okay. So that I fall asleep immediately. Kita ba tayo ni Doc? Yes, I see you now. I see the chat now, but the chat doesn't pop up on the stream overlay, and I don't know why. Alright, we're gonna talk about your nuts now, okay? I mean, as men, I'm sure majority of you, probably 90% of you are all men or biologically male. So you guys pretty much know your junior very well, right? I'm pretty sure you guys have touched that before. So this is gonna be my first medical education stream that has less censor than the previous ones. My past medical education streams had the heavy censors because I used to stream on Twitch, right? And it was only recently that I just actually read the toss of YouTube, and looks like I can stream this without much censoring as long as we stay on topic. Okay, this is for educational purposes. Hey. Guys, I'm talking about biological male. Whether or not you identify as something else doesn't change the fact that you are biologically male, okay? If you guys are biologically male. You can identify as a woman, as a female, but if your what do you call this? Your phenotype, and if you're biologically, if you biologically have the male reproductive system, I will refer to you as male for the purpose of this medical education stream, okay? Alright. Now we go to the... Let's start, okay? We're gonna start. Let's go to the... Okay, let's get my laser pointer ready, because we're gonna do that. Okay? Alright, anatomy! Anatomy, okay. Alright, this is a sagittal view or a longitudinal slice of your pelvic area, okay guys? Now, we can see a lot of structures here aside from the male genitalia. But for this lesson, for our medical education stream, we're going to focus on this right here. Alright? Okay. So, parts of the male, what do you call this? Reproductive system. So right here, this white thing right here is your testes or your testicles. As your testes, this is your, itlog nyo basically. This is your egg. This is where your sperm is, produced. Okay? And then after this, we have this one right here, which is called the epididymis. Okay? Epididymis, which is connected here to your vas deferens. Okay, this is wrong spelling. This is supposed to be vas deferens. This is the tube. Alright, that connects your testes to here. This is the seminal vesicle where your semen is produced. And then here we have your prostate right here, where the ejaculatory duct is. And this tube here going out through the penis is called the urethra. Okay, this long thing right here is called the urethra, and then this whole thing's the penis. Okay? It's pretty easy. Very easy. You know, you male reproductive system, look at this. You only just have like one pathway. You just wee. Okay? Male fallopian tube. Well, yeah, I guess you could call this like the male fallopian tube, the vas deferens. Okay? This vas deferens is a very, very delicate and important structure. We have to avoid cutting this during hernia surgery. If you notice here, it goes through the inguinal area where hernias usually happen. And you know, if a surgeon accidentally cuts this, then you're gonna be sterile for like the rest of your life. Yeah. This is the vas deferens. This is what they actually cut when you have a vasectomy, so that you can't impregnate anybody. So, vasectomy is when they cut this. Okay? So, that's basically the anatomy. Alright? How about the blood vessel? Oh, the blood vessels. I didn't cover blood vessels because that's a lot. But basically, they have the testicular artery, testicular veins. It's connected to the spermatic cord, which I don't have it here. Okay? Usually that one I discuss on hernias. Alright? Alright, next. Sperm pathway, okay. I pretty much said it a while ago, but let's do it again. Okay, we're gonna get my pen. Get a pen. I'm going to use what color should I use? Let's use blue. Okay. Alright. Alright! What happens when you nut? Okay? When you guys are nutting constantly, this is what you guys have been doing every day, and this is what your sperm, the distance and where your sperm had to go every day. So starting from here, starting from your testicles, your testis, okay, the sperm is gonna go through the epididymis. I just basically traced it, okay, through your vas deferens. Go here, okay, there, and then into the seminal vesicle. This is where your semen is produced, the fluidy part, the liquidy stuff, yeah? The liquidy white stuff. Here. And then it squeezes it out into the ejaculatory duct in the prostate. Alright? And it goes down here. Through your urethra. And out. Alright? It's simple, right? That's very simple. So yeah, you men, this right here is your urinary bladder. So you actually pee at the same air. You have only one tube, so you pee and ejaculate in the same tube. So basically, your ejaculate can have like a mixture of pee in it. Ew, nasty, yuck. Nah, I'm just kidding. But it will only have like a trace of pee. You cannot pee and ejaculate at the same time. Alright? You cannot. It's physiologically impossible to pee and ejaculate at the same time. Because the reason is because of the nerves. The nerves associated. The innervation and the nervous, the nerves associated with urinating and ejaculating. They're completely opposite. If I remember, if any of you are like familiar with sympathetic innervation and parasympathetic innervation, that's basically it. If I remember correctly, sympathetic would be urinating, and parasympathetic would be ejaculating. So they're opposite. It can't happen at the same time. Okay? Alright! Next, let's clear this up. Let's erase all this. Okay. Next. Alright, what is the purpose of the male reproductive system? You guys know, right? Wait. Alright, next. Okay, so the purpose of the male reproductive system, guys. Come on. Y'all know this, okay? Oops. Okay, according to Genesis 9:1, if you know your Bible studies, okay, God blessed Noah and his sons and said to them, be fruitful and multiply and fill the earth. Guys, you gotta be say-so. The male reproductive system is a say-so system created by God. Say-so. Say-so. Alright? You gotta be holy. Only holy. Magdasal kayo araw-araw. Holy. Alright. Siguro naman. This is a holy say-so stream, okay? Okay? What? Walang ano, diba? Wala namang demonyo sa inyo. Holy nut. Dasal, okay? This is, ano tawag dito? Banal stream. Banal medical education stream, okay? After this stream, I promise you guys, after this medical education stream, after the stream, you just got yourselves plus 100 langit points for knowing about your nuts. Okay? Alright. Well, basically, but yeah, basically, what the hell? Basically, the purpose of the reproductive system is to produce certain hormones such as androgens and testosterone, which help in the functions and the development of your, of your male reproductive organs. It produces sperm, and of course, you help make babies, okay? The purpose is for you to help make babies. Yeah? Yeah. Convert na. Okay, next. Okay, diseases. This is where we get this is where we get to the gross stuff and the interesting stuff. Oh, before we go to diseases, you have any questions, by the way? You guys have any questions before we proceed to the diseases? Maybe you guys have questions. Let's see. Duck is say-so. Yes, I am say-so. This is a very say-so educational stream. Gandang emote. Yeah, it's my email on Discord. If you want to use that email, it's on Discord. Yeah, this after this stream, you guys will have like 1 plus 100 language points. Don't worry about it. Can you still function even if you have one ball? Yes, actually. We'll get to that later. Matatrauma ba ako dito? Depends. It depends if you are a banal supporter, you won't get traumatized. You'll be holy. You will come out of this stream holy and a new person. How do we make babies? Really? I'm not gonna explain to you sexual intercourse. You gotta check. You can check. If you wanna know how to make babies, you can go check certain websites that demonstrate on how you make babies. I came in late. Sorry. Have you discussed? Not yet. I haven't discussed that yet. We just got through like anatomy and physiology and purpose of the reproductive system. Ang true hermaphrodite ba ay may functional gonads? It depends. But I've actually seen a true hermaphrodite one time. And yeah, they did have functioning testicles. But he didn't have like a proper looking penis. Okay. Is nothing really help fight prostate cancer? I'll get to that one later. Question now is, am I banal? You will be after this stream. Oh god, okay, there's a lot of, from Ponpon to Supporter. Alright, a lot of your questions are actually gonna be answered in the next slides. How to make baby podok? Okay, Chado, if you wanna know how to make baby, actually, you just have to order a baby from the store. They'll deliver it to you in your house. It's that easy. Siguro mga ano lang yan. It'll probably cost around 5,000 pesos per baby or something. I don't know. Alright, next! Let's go to diseases. Alright! This one is very important. Okay? STIs. Nobody wants to get this. None of you want to get this, right? None of you want to get STIs, sexually transmitted infections. Symptoms. Symptoms of STIs are penile discharge. So if you notice that you have weird fluids coming out of your penis that is not seminal fluid or, you know, not your ejaculate and, like for example, nana, pus coming out of your penis, then you gotta start worrying. Rectal lesions. Rectal lesions from obvious reasons, you know, as a sexually transmitted infection. If you have something there, if you have something up there and it doesn't feel right, then yeah, you gotta, and you know you have done something, then yeah, you better stop worrying. Okay, oral lesions for another obvious reason. If you have like warts or what do you call this, rashes and stuff on your mouth after doing something with your mouth, then yeah, you get it. And of course there's pain. A lot of these are painful. Alright. Kala ko school yun. Ah, yeah, STI school. Yeah. That is a school, but STI is also for sexually transmitted infections. I think it's because a lot of people would say STD, right? A lot of you would call it STD, but actually the proper one is STI. Yuzuria, thank you for your sub. It's sexually transmitted infection instead of sexually transmitted disease. So I'm using STIs. Okay. Tulo, yeah, tulo is the penile discharge. Yep, tulo, you gotta start worrying. Okay. Alright, next. Commonly caused. So if you have any of those, if you're suspected to have an STI, you're going to be tested, definitely, for at least these diseases. What do you call it? Bacteria, virus. The common one is chlamydia or gonorrhea. There's also syphilis and HIV. Of course, everyone fears HIV. I never knew this church had a flu. Yeah, it's called tulo. Tulo. Different sex infection to the disease. No. It's just that the proper term is actually STI. It's not STD. Chlamydia, yeah. Chlamydia, gonorrhea, and syphilis. So, if you are tested positive for any of this, the protocol is that you have to, the partner or the partners have to be contacted and get tested too. You know, because you never know, what are you spreading this shit around? You know, you gotta find the source. Or more like you have to find who else is infected and then treat them also, you know? Alright. I think someone asked if I had pictures. No, I didn't put any pictures of this one. They're pretty graphic. I didn't have pictures of those. I didn't put it. I mean, you can already just imagine. Imagine thick yellow substance coming out of the urethra of your penis. And then imagine warts. Yeah, warts. There's also one called like genital warts caused by HPV. Yeah, it basically think about your genitals having cauliflowers all over it. That's genital warts. That would be the worst case scenario. Think of your penis as a big ass cauliflower. That's it. Okay? I'm pretty sure you guys don't want to see that. I'm pretty sure you guys don't want to see that. So I didn't put that there. And yeah, those kind of warts can also be on the anus if the person engaged in anal sex. So yeah, imagine cauliflowers on the anus. That would be it. Very pleasant description. Yeah, literally like a cauliflower or a broccoli. All right. Flesh-colored broccoli. Think about that. There we go. Yeah, I think it's more like cauliflower, flesh-colored broccoli, and flesh-colored cauliflower. Okay. Syphilis. Oh, syphilis is very painful. It appears like lesions, like reddish lesions or blisters on the genitals, sometimes in the mouth. I think, if I remember correctly, I read somewhere, if you guys know the movie, you know Jack Sparrow, right? Jack Sparrow, they say, had syphilis in his, if you notice, he had like a wound on his lip area. They say that he actually has syphilis. Jack Sparrow. I read it somewhere. Alright, next. Alright, next disease, Epididymo-orchitis, or epididymis. It can be epididymitis or orchitis, but usually they're combined together. It's basically inflammation or infection of the testes and the epididymis. Okay. And how does it present? You would come to the ER complaining of pain and swelling of your balls. Alright? It is a very painful disease. But this kind of disease, you can manage this medically. Usually this is diagnosed with an ultrasound. So if you go to like the ER, you come there complaining of usually the patients will be like, masakit yung itlog ko. They would be like that. Or namamaga itlog ko. So, after physical examination and history, you order an ultrasound. And that will tell you if it's epididymo-orchitis or something else. Okay? Now, if you have epididymo-orchitis, this is very easily treated. All you gotta do is just take antibiotics and pain relievers. That's it. Alright? Is this like dysmenorrhea for men? No, it's not. This is totally different. Alright, next. Yeah, here we go. Treatment is medical management. All you gotta do is just take antibiotics, pain relievers, and you should recover after about like a week. Okay? Now, what about torsion? Testicular torsion. This is the pain is similar to epididymo-orchitis, but what happens here is that your testicle twists itself on the spermatic cord. So this is the normal testes, this pink one, and this purple one is a twisted ball. Sometimes what happens is it twists so much that the balls become more horizontal, like Borgar, thank you for subscribing. Like, it would be like this. It would be like that instead. Something like that. So, like horizontally oriented. And then the swirly. Alright? It is very painful, so this kind of disease cannot be treated with medicine only. The management of this is actually surgery. So, what kind of surgery? It's an emergency orchiopexy and an emergency orchiectomy. When you say orchiectomy, you have to remove it. Okay? So, wait. Orchiectomy is remove. Alright? When you say orchiopexy, you suture in place. Suture in place. There we go. Okay? So, alright. How do you do an orchiopexy? Alright. Let me explain. So let's example, let's example, this is your eggs are. Alright? Basically, when an orchiopexy, you're gonna suture the testes to the scrotum. Around here. Like, one suture here, one suture there, and another suture here. So that it stays in place, okay? Because, someone asked, what is the cause? The cause of this is having a testes that's freely hanging. Like, freely hanging and movable. They call it the bell flap deformity. It's a deformity, you're born with it. Basically, your balls is just hanging around freely inside your scrotum. Alright? Okay. But when you say orchiectomy, it's... when we say orchiectomy though, okay, when you say orchiectomy, you really have to remove this. Cut this off and remove the entire... Remove the testes. Okay? And, testicular torsion is considered an emergency. Because, if you leave the testes there... If you leave the testes there, twisted, and if it's twisted at the spermatic cord, the blood flow is blocked, and the blood flow can't go into the testes. So what happens is the testes dies. It turns purple, and then later turns black, and then it just rots in there. And it can actually kill. That's why to be saved, you gotta urgently have surgery. Alright. Alright. Let's, next. Alright! Benign prostatic hypertrophy. BPH. This is, basically, BPH. So this is prostate. So look at this happy urinary bladder. Happy urinary bladder. This right here, this here, this is the prostate, okay? The prostate sits right on your urethra. Okay, I mean, if you look at my previous slide of the anatomy, the urethra is within the prostate, like part of it anyway. Okay. And if you have benign prostatic hypertrophy, this means that the prostate gets bigger, enlarged. So look at this. Big prostate lobes. And what happens is it's narrowing the urethra. So what happens is usually these people, they complain of urinary symptoms. Alright? Next. These are the symptoms of people with BPH. Usually, BPH is usually an illness among older men. So, lahat kayong mga lalaki dyan, I'm gonna assume that you guys are like what? In your teens to 20s or something? Early, young adults. Let's say you guys are teens to young adults. When you reach your old age, you're going to have large prostates, and you guys are gonna eventually complain about have urinary symptoms. Like, for example, interruption in the urine stream. Meaning, while you're peeing, suddenly it stops and then it goes again. See, look at this. It's like it's dripping. Like little drops right here. Okay? Frequent urination, especially at night. We call this nocturia. So this is like, you wake up at night because you feel like peeing. So you go to the bathroom many times. Hesitation before beginning urination. So let's say you feel like you're going to pee. So you feel like you're gonna pee, you're gonna go to the bathroom, you're gonna take a piss, but what happens is nothing's coming out. Like you want to pee but nothing's coming out. That's hesitation, okay? And then feeling bladder is full even after urination. So you already peed, and then you finished peeing, but then even after you finish peeing, you feel like there's still more. There's still more pee in there, but you can't really actually pee it all out. Alright? Terminal dribbling. Basically, you pee yourself, and you can't help it. But it's not really actually like a straight flow of pee. You're dribbling, like little drops start coming out, and you can't control it. Okay? And then the urgent need to urinate. You always feel like you have to pee. You have to pee. You feel like peeing, but then you have difficulty peeing. Weak urinary stream. Okay. This means, if you look at how you pee right now, your pee is definitely strong. The stream is strong, like a river. This one would be like more like a when you open your faucet and it's like flowing strongly. This one is like dripping really or trickling pee. It's not strong, the stream. Okay? Wait, Tagalog ba niyan ay balisawsaw? I think balisawsaw is more like more on like UTI, described in UTI when they pee but it hurts. That's balisawsaw. At least that's how I understand it when I talk to patients. All right? How do you reduce the symptoms if possible? You have to take medications. It's gonna be your maintenance medication. Usually they give tamsulosin or what is the other one? Finasteride. But you can ask your dads or your grandpas about this, what their maintenance medication is for their prostate. This is an illness very common among old men. So when you guys grow old, you're gonna have this problem. Alright? We women don't have prostate, so we won't have this problem. Is balisawsaw real? Yan yung kapag umihi ka daw sa mainit na semento. What? Balisawsaw is the description people use when there's pain and urination. Like when they pee, it stings. It stings and it feels like you don't want to pee because it hurts. That's what I get from balisawsaw. Duodart iniinom ng tatay ko for BPH. Yep, that's one. Duodart is like a combination of finasteride, I think, and I think the combination of tamsulosin and duodart. I mean, and finasteride. That's one. Yeah. Yes. Balanitis and prostatitis. Okay. This one's usually seen in children. Alright? You know those little children that don't clean themselves properly. So, balanitis Balanitis is infection of the head of the penis, the glans. Okay? The glans is the head of the penis. Prostatitis is infection of the prepuce, also known as the foreskin. Okay? So, this is usually seen in children. If they don't know how to clean themselves, they get infection on the head of their penis or in the foreskin. So, here we go. Look at this. We have a swollen head right here that feels like it's choking. And we don't have one about the prepuce or the foreskin, but let's just imagine that this right here is swollen. Swollen foreskin. Okay. Okay. How is this managed? For the management of this, let's see. The heck, I can't even. Treatment. So wash yourselves. Clean yourselves properly, boys. Alright? I'm pretty sure you don't want to have like nasty shit on your penises, okay? Clean yourselves properly and teach your children to clean themselves. Also, another treatment for that is antibiotics, medications. If all else fails, then especially for prostatitis, inflammation of the prepuce or the penis, the foreskin, yeah, you gotta get a tuli now. You gotta get a circumcision. Okay. Alright, next. Hypospadias and cordy. Okay? Bakit nandyan si Wolverine? Wolverine! Si Wolverine yung magtutuli. Ayaw nyo yun. Alright. Question, is circumcision really necessary or is it a rite of passage? I actually have a stream on that. I made a stream about that. It's one of my most watched medical education VODs here on YouTube. I will show you that later, okay? I will give you a link, you can watch that. But if you want like a straight up answer, if you want the quick answer, it's a rite of passage here in the Philippines. But it becomes necessary because children here don't know how to clean themselves. And because, those people, especially the masses, they don't really exactly have access to the cleanest water. So even if they clean themselves, they're still they still cannot, clean properly. Okay? Alright, hypospadias or cordy. When you say hypospadias, I believe I mentioned this before. Hypospadias means that your urethra, or where you pee, is in the wrong or it's abnormally placed. So normally where you pee is at the tip. Yes. Normally is at the tip. In a patient with hypospadias, they would be peeing somewhere here. So it can be lower, or it can be here at the rim of the head of the penis, or it can be on the shaft. It can be near your scrotum, or it can be at the scrotum, or even between the scrotum and your anus where you pee. That's hypospadias. Of course, the lower it is, the worse it is. Alright? So I've seen patients who have this. It's usually children because it's a congenital defect. I had a patient who had to urinate from here, the shaft. Okay, it's really, when he pees, it's like a shower head. That's what they say. So yeah, you gotta surgeons have to correct this very early, because of course if they get older, it's gonna be harder to operate on, and of course it's going to affect their, you know, sexual function. What is that really? Yeah, I've seen this. And that's what hypospadia is. When you say a cordy is related to hypospadias. It's usually present in those with hypospadias. Cordy is like an excess piece of skin that connects the scrotum to the penis. So normally, you know how your penis looks like, right? Normally, you would have the scrotum and your penis would be hanging down, normally. And if you get a hard-on, it would stand up properly, right? It will stand up. If you have hypospadias and cordy, there is a loose extra skin connecting the scrotum to the penis. So what happens is you get a curved penis. It curves downwards. And it can't stand up. Even when you get hard. Even when they get hard, yeah. Alright? It just bends downwards. So if you have a cordy, you won't be able to function well sexually because it doesn't stand up. It's bent downwards. Alright? Ano ba itsura nun? Ano ba itsura? Ito. It's here. And my head's blocking the way. I'm sorry, my head's blocking the way. Hold on, let me move myself. Oops. There you go. There you go. See? It's locked. Locked. Is it possible to have two outlets? No, not really, because this is related to the urethra. So if you have one outlet, that's it already. Because your pee is gonna be coming from here, going that way. So if you have one opening here, then the pee comes out here already. Alright? So, what do we do with this kind of disease? This one needs major surgery. So what happens is repair and circumcision. Okay? So imagine this one right here is a penis and the urethra is here. They pee here. So what they're gonna do is they're gonna cut this up and get the skin. First they're gonna put a catheter through the hole. And then they're going to cut the skin of your penis open. And then sew it back together. Yeah? There's a more graphic one here. Alright! Imagine your penis having this kind of surgery, okay? Yeah, I told you guys, this is gonna be graphic. I just found this is like very tame, man. Imagine if I showed you actual videos or photos of this. Alright? So, look at this. This guy pees from here, so you gotta put a catheter in there. And then, you're going to have to cut this open and you basically skin the penis, okay? You're going to skin that. Yeah, look at this. Skin it and free the penis from the skin. And yeah, oh, this one. Yeah, and then what happens is, we're gonna tie it. Because this is gonna be bloody, right? So you're gonna put a tie here, you're gonna tighten it so the blood doesn't flow. Alright, and then you're basically going to repair. You're going to make a new urethra out of the excess skin. That's basically it. You're gonna make a new tunnel. Going to the end of the piece. Okay? For what procedure is this used? For hypospadias. For those who just got here, this procedure is for hypospadias. Here. Alright? Because you gotta move the abnormal urethral opening to the tip of the penis. Right, next. Okay? Phimosis! This picture is like the perfect representation. I showed this in my Tule stream before because this photo is like the perfect representation of phimosis. Phimosis is basically when your prepuce, especially in uncircumcised people, when your foreskin is too small that the head can't come out. You cannot retract it. So yeah, this is basically the perfect representation. Here we go. Yes, like see, in a good foreskin, you can retract it all the way down here, right? Now look at this guy. He's crying because it's too small. He can't retract properly. Okay, that's phimosis. And we got here like a head peeking out. So what do you do in a patient with phimosis? We tule the patient. Okay, circumcision is the way. Yeah. It is one of the medical conditions where you really need a circumcision. Okay. So, tule. Di yan uso sa Pinas except kung supot ka. Well, there are some kids I saw that have phimosis. Yung mga nasa mission. Alright, next cancer. Testicular cancer. So, guys, testicular cancer is actually very more common in younger people. So, if you are within the age, if you've already passed the age 20, you're already at risk for getting testicular cancer. A lot of people with testicular cancer are young men. Okay? So, how do you know? How will you know if you have testicular cancer? One of the symptoms is having a hard mass or tumor, feeling a hard mass on your balls. Okay? Painless. It's painless, it's firm, and it's on your balls. Okay? So you guys better start feeling your balls right now. You never know, what if you got something hard there? And how do you diagnose testicular cancer? If you suspect to have testicular cancer, you're gonna have to have an ultrasound. The ultrasound will confirm if it's a mass. A testicular tumor mass is the conduct is like, if you have a mass in the testes, it is considered cancer unless proven otherwise. So immediately, if you have a tumor there, the treatment immediately is to remove it. Okay? Radical orchiectomy. Like I said, orchiectomy means to remove. Alright? Like I said, orchiectomy means remove. Ball check. Okay. So, you know what? I was actually supposed to, the previous slide on phimosis where there was supposed to be a circumcision. I was supposed to put Kamiya's PNG there. But I didn't anymore. Wait, Rian has balls. Apparently he has balls of steel, as he would say. Anyway, so yeah, radical orchiectomy. I think I have another slide for this. Oh no, I don't. Okay. Radical-oectomy, you have to cut it from the spermatic cord and remove the balls, the affected balls. Out. Okay. Iba ang orchiectomy sa vasectomy. Orchiectomy is removal of the testes. Vasectomy is when you cut the vas deferens, which I mentioned in my first few slides. I showed the anatomy of the vas. I mean of the the male reproductive system. Okay. Right. Next. Oh wait, I forgot to we gotta remove the ink. Alright, next. Prostate cancer. Alright. Prostate cancer presents just like it presents pretty much similarly to BPH, because in prostate cancer your prostate gets larger. But yeah, you can only diagnose this by certain laboratory tests and a biopsy. And the treatment for prostate cancer is... We got a bunch here. Prostatectomy is the surgical management where you remove the prostate here. It's a very complicated procedure, by the way, because, like I said, the prostate is very closely related to the urethra where you pee and your ejaculate passes. So, when you remove the prostate, you have to reconnect the urethra to the bladder. Right? I do the PSA. Yeah, PSA. You do PSA. Okay. So other treatments for it is chemotherapy, of course, especially for advanced stage prostate cancers, and radiation therapy. What's the difference from BPH? BPH is benign, meaning it's not cancer. You just get bigger, your prostate just grows bigger. Cancer is cancer. It's malignant, it can kill you. Yeah. Alright! This question, everybody asks this. Is it healthy to always nut? And is there a purpose for N and N? Yeah? I think I mentioned this, I actually mentioned this, was it yesterday? Or the other day? People would say, you know, those people who were like, say, no, you should nut. You should always nut because, you're going to prevent, it'll lessen your chance of getting prostate cancer. That's what they say, right? That's what people are saying. Those people who are like, non-stop nut November. No, we must nut for our prostates. Nut for our prostates. Oh, man. Alright, is it healthy to always nut? The answer is actually, it's not exactly healthy, nor is it unhealthy. It's just like, you're just nutting. You're just ejaculating. Okay? Those people who say that, nutting, there are definitely studies that say ejaculating, reduces your risk, they say reduces your risk of developing prostate cancer, right? That's basically what some study says. But if you look more, there are other studies that say otherwise. That they say, no, there's no relationship between ejaculating frequently and reducing your chances of getting prostate cancer. So there are conflicting studies actually. I remember I mentioned this in my last stream. We actually looked it up too. There is actually no consensus or no confirmational study or, that really says that yes, that ejaculating reduces cancer. There's no confirmational study, or no consensus. There we go. There's no consensus yet. Okay. So, if people say, you should keep nutting because it will reduce your chances of getting prostate cancer. You can just tell them, no, that's bullshit. Or maybe you could just say, oh, it's not exactly true. But, NNN is good kasi dumadami ka siya. Yeah. Honestly, actively stopping myself from that allows you to focus on other productive stuff. It makes you feel good and happy. So basically, people just nut because they want to, okay? Come on. None of you nut for the purpose of preventing yourselves from getting prostate cancer. You just do it because you guys want. That's the truth. Alright, next. I think that's my last slide though. Yeah, it's my last slide. Alright, you guys have any questions? We can go back to some slides if you guys have questions, Let's see. So basically, no harm, no foul pag jabol basta hindi sila. Yeah. I mean, I think I saw someone ask, how much is too much? Someone asked that. The perfect answer to that question is, how does your body take it? Your body will tell you too much is too much. I mean, if you're already getting dried up, getting tired, then it's time to stop. What happens if you do DDD? Well, DDD as in like destroy December. Well, you basically destroy your dick. Destroy it. Doc, have you discussed what are the common causes of these diseases? Which ones? I discussed like STIs. Yeah. Well, wait. Okay. Oh, Chips. Hi, Chips. You're here. Doc, why does my right ball hang lower than my left? That holds true for everybody. Everyone's right ball is lower than their left. The reason for that is because the right one is the first to go down. I mean, like, in, ang tawag dito, in, what do you call this? In embryology, there we go. In embryology, when you're a baby, when you're still a fetus and developing, and then when you're born, your testes actually come from inside your abdomen, and then what happens is in the embryology they go down. Let's make a drawing. Let's draw it. Abdomen. Let's say this is the right and this is the left. I don't know. Let's say this is the ball. It's supposed to go down, right? The reason why the right one is lower than the left is because the right one is the first one to go down, to descend down. It goes down first before the left one does. Okay. Doc, walang connection yung sperm at pineapple. What do you mean by sperm and pineapple? What do you mean? But that means when the ball sags, that means when it's contracted. It's a tawag dito. Reflex. They call it the cremasteric reflex. Cremasteric reflex. I actually like playing with this sometimes. On patience. Cremasteric reflex. How do you elicit this? How do you elicit the cremasteric reflex? I will tell you how. It's done. This is your legs. This is the... This is your balls. If you lightly touch your upper thigh in the middle, the reflex is that your scrotum or your testicles goes upwards. So if you do it on your right thigh, the reaction would be for this to contract and move upward. It's the same for this. It's gonna go up. It's called a cremasteric reflex. It's a reflex in guys. And it's actually a good test for torsion. Because in testicular torsion, if you have a negative reflex for this, then yeah, it's confirmed that you have torsion. Yeah, it's a reflex. It's due to temperature, right? Okay, yeah. The reason why also. The reason why it is better for your testicles to stay in here and not anywhere else, like inside your abdomen. You know how sometimes some babies, when they're born, that's why the testicle has to go down. The testes has to go down. Sometimes they have an undescended testes. Or, I think, if I remember, it's called, the medical term is cryptorchidism. Cryptorchidism is when you have an undescended testes, or the testes stays up. You need surgery for this. What the surgery needed is an orchiopexy, which I mentioned a while ago, wherein you tie the you suture the testes to the scrotum. So what happens is you're gonna bring this down, and then you're gonna suture it to the scrotum. The reason why this has to be done is because if this testes is not brought down here, it has to be removed early. It has to be removed because you have a chance of developing testicular cancer after that if it stays there. You guys have any more questions? Let's clear this up. Oh, it's 10:15, exactly an hour. Well, a little more than an hour. You guys have any more questions? Before we have our quiz. We always have a quiz, right? Whenever I come, may kasama siyang tubig. I don't know what it is. Does it smell like piss or cum? I'm very curious to know what it is and working. What do you mean by kasamang tubig? That's your semen. That's semen. What's the medical term for loose hernia? Hernia. Hernia equals loose. Alright. Are there cases where the left nut is lower? Yeah, I haven't seen any. But I think there are some cases where the left testes is lower, but it doesn't really mean anything. The important thing is they're still there in the scrotum. That's the important thing. Pahimas po ng balls para... What the hell? Alright! Okay, we're going to, okay! Exam time! Quiz time, guys. Quiz. Kaya, magka-quiz tayo. Okay, guys? Let's see, 5-item quiz. Okay. Quiz. Alright, everybody! Quiz time! Everyone, get 1/4 sheet of paper. 1/4 sheet of paper! We're gonna have a 5-question quiz. Equal yung choices of quiz. Actually, yeah, I could do that. The problem is I can't do it here on OBS. Wait, I think I could do it on... Can I do it here? Oh, I could do it here! Pwede. Hold on. 1/4, yes. 1/4! Okay, question number 1. Question number 1. Okay, let's go with something a little, Question... Why is it not writing? What the heck? Question number 1. Where is sperm produced? Oh, sige ha, madali lang yan ha. Where is the sperm produced? Open notes. Alin nun yung open notes? The nuts. Bruh, be scientific with it. This is balls. Whoever answers the word nuts will, may minus, minus 10. Okay. We're gonna be we gotta be, professional here. Medical terms. Testis. Oh, so sino yung mga sumagot ng nuts? Nuts minus 10. Yung mga nagsabing balls. Minus 10 din. Oh, minus 10. Tiyo, negative na yung score nyo. Nipple. Ang layo naman ang nipples. Okay. Next question. Next question. Next question. Okay. Name one STI. I gave like a list. I think I gave at least 4. At isa lang oh. Gusto ko talaga makakaya. What STI? It's like 4. I gave 4 in my previous slides. Chlamydia, syphilis, HIV, tulo. Chlamydia. STI college ko lang ba? Grabe naman ginawa niyong disease yung school. AIDS. Okay, AIDS. I wanna say something about AIDS. Since Minokalo said, something. AIDS is not actually the virus. It's the disease. It is the end-stage disease caused by the virus. So it's not exactly STI. End-stage. But it is caused by an STI. Aim high STI. Hepatitis. Yeah, hepatitis can. But there's different types of hepatitis. So you have to know which one. Aim high. STI branch sa kamot. Teka, sino ba sa inyo graduate ng STI? May STI graduate ba dito? Is there someone here who graduated from STI? Sino bang STI graduate dito? Meron ba? Herpes. Yep, herpes is one. Proud STI graduate. O yan, si Manager D, proud. Si Manager D, STI. STI. Alright. O sige, STI graduate. Since STI graduate ka, plus 1. Mga STI graduate plus 1. Plus 1 sa mga Okay, next question. Alright, next question, guys. Purpose of the male reproductive system. Purpose of the male reproductive system, okay? Tapos, number 4, connected sila, ha? Number 4, give the Bible scripture. Dapat yung Bible scripture, bigay nyo pati yung yung text. Okay. Pag nakuha nyo yung Bible scripture, ito, plus 100 langit points. So, ito yung purpose, ito yung scripture, ha? Okay. Hoy, binigay ko yung scripture sa slides ko. Kung nakinig kayo, masasagot nyo. Masasagot nyo. Plus 100 langit points sa mga nakakuha ng number 4. Not mother to me. Na-late kami. Hindi ko problema kung na-late kayo. Lahat ng late, okay, since may mga latecomers here. Latecomer. Latecomer minus 100. Okay. Okay, mga late minus 100 points na si Peace. Dog Shiori slide 6. Binilang mo ba yung slide? Okay. Okay, number 5. Ma'am, galing po ako laro sa ng varsity. Walang excuse. Late is late. Hey! Alright, number 5. Tapos dito sa last one, we'll have bonus. Bonus question after ng 5, ha? Reproduce, reuse, recycle. Okay, number 5. Okay, number 5. How to treat testicular torsion. And you don't need to say the exact term, but just tell me how do you surgically treat a testicular torsion? Tapos yung bonus, yeah, torsion is treated surgically, but what exactly do you do? Kuha ng Beyblade. Hilot ang ina. Sakit naman nun. Imagine may torsion ka tapos pinahilot nyo. Papayag ka. Imagine you have the worst pain of your life on your balls tapos papahilot mo. Ang sakit naman nun. Grabe naman. Call Wolverine. Pinutol ang nuts. Wait, Doc, na-discuss ba penile fracture? No, I didn't. I didn't because that's not something I see commonly. There are a lot of penile diseases and trauma, but I didn't really cover all of them because if I covered all of them, this stream would take forever. Lagyan ng fix. Evidence-based practice. Tayo na, Vicks. Sige, pag kayo may torsion, lagyan nyo ng Vicks yung balls nyo. Bahala kayo. Alright. Next. Bonus question. Okay, itong bonus question. Bonus question plus 200. So, ayan. Makakabawi kayo sa mga late nyo at mga minus nyo. Okay? Bonus question. After Big Silot. After Big Silot next. Okay, after the bonus question. Okay. Did you lose N and N? Okay. Did you lose N and N? If your answer here is yes, wala kang bonus. If your answer here is no, may bonus ka. But you have to be honest. Honesty is the best policy. Honesty is best policy. Talo na ako dahil sa Shiori poster. Ano yan yung hotdog? Hayop kayo. Hayop kayo, ate. hayop kayo. Teka ha. Wait lang. Yung mga nagsisinungaling dyan. Teka. Dapat honesty is the best policy, you guys. Dapat dapat hindi kasinungalingan yung ginagawa nyo. Dapat hindi kayo nagsisinungaling. Honesty is the best policy. Nagbabantay na si Jesus sa inyo. For bonus. Yung mga honest dyan, plus 1,000 langit points. Okay. Bonus plus 1,000 langit points. Pag honest. yung di honest, walang bonus sa number 4. Nagsisinungaling pa ba kayo? Alright. Okay, pass your papers yung mga, sino bang pumasa? Piling ko lahat kayo bagsak. Okay, we're gonna pass your papers. Yeah, tanggalin ko na si Jesus ha. Teka. Actually, hindi dito. Nagbabantay si Jesus sa inyo. Okay! It is 10:35. I think we're good for this stream. Okay, like I said, guys, diba sabi ko, at the end of the stream, magiging banal na kayo. Okay? Banal na kayo. Diba? Amen. Magiging banal na kayo after this medical education stream. Banal na kayo. Ayan, binabless. Oh, man. Okay. Amen. Ayan, sabi. Okay. Sige, tanggalin ko na si G. Tanggalin ko na. Okay. And that is, oh my God, wala yung chat. Wala pa rin yung chat dito sa tabi ko. Alright, guys, I guess, that's all. Okay na yan. Announcement, let's see. Yes. Tomorrow, I'll be streaming on Twitch again. Twitch ulit tayo bukas, guys. I was supposed to stream VR chat tomorrow with Rion at 2 p.m. Pero that's gonna be cancelled. Cancelled muna. Something came up, so I can't really push through with the VR chat stream. But I will stream again at night tomorrow. We'll play Chrono Trigger. I wanna play Chrono Trigger. And I might be able to play a little longer now, so baka mas matagal na ako mag-stream bukas ng gabi since I don't have work the next day. Yeah, I can sleep late and wake up late. Yeah. Try VR Among Us. Yeah, I would, but I want to play it with other VTubers. I think someone is already inviting me to that, and they're planning one, but I think they're still looking for other participants. Surprising kaya pag nag-stream si Renew. No stream, no, yeah, that one's cancelled. The one tomorrow, unfortunately. But I will stream tomorrow night. I'll probably stream a lot longer than my usual, because you know how I stream, like, I start at 9 and then I end at around 11:30. I might go a little later than that because I don't need to wake up early the next day. We'll see. Doc, do you sometimes dream that you're doing surgery? That actually happened before. Okay, yeah, I think, yeah, that's all. Alright. Thank you everyone for coming to my... No, not November stream. And also I would like to ask for your help. I mean, oh yeah, that reminds me, I forgot, hold on. If those who missed or haven't seen my, circumcision stream, because I think someone here was asking about, circumcision, and I said I have a stream on circumcision. It's a VOD already, uploaded on my YouTube channel. You can just you can watch my Tuli stream there. It's one of my most watched streams. Actually my next my other most watched medical education stream is the one about lungs for some reason. Is it lungs? I think it was about lungs. So it's a Tuli stream and the lungs. You can watch you can just look at the playlist. I put it on a playlist. There's a medical education stream playlist. You can look for them there. Stream link? Oh wait, hold on. I'll give you guys a stream link. I'll give you guys a stream link. Hold on. Somewhere here on the playlist. Tuli stream. Oh. Okay. There's the Tuli stream. Right? Somewhere. Okay. Here we go. I got it. Oh, there we go. Chadomatsu posted it already. Let's post it some more. Spam it. There we go. Tuli stream. It's there. Kailangan natin talunin yung slums. Yeah, no, I just spammed it. But yeah, cause you know I looked at my watch hours on YouTube and it went down. It actually went down by a lot, so I don't think my YouTube will be monetized anytime soon unless you guys actually like rewatch some of my streams or something. I don't know. All right. Anyway, yeah. Thank you so much for coming to my medical education stream. I'm gonna see if this VOD will still hold up until later on, because I know that I showed photos here of like uncensored penises and all that. Well, it's not really that explicit as long as it's educational. I read the YouTube toss. As long as it's educational, they'll permit it. Yeah. Thanks for listening. Yep, thank you. Otsupon, everyone. Have a good night. I'll see you guys tomorrow night on Twitch. Okay, I hope you guys learned a lot from this. Alright. Thank you. Good night. Goodbye, everybody. Bye-bye.